This portion of New Day Northwest is sponsored by Bellevue Plastic Surgeons.
The #1 hot topic at the annual Conference of American Society for Aesthetic Plastic Surgery in New York last month was fat. Dr. George Marosan from Bellevue Plastic Surgeons was there, and he brings us the latest news about fat grafting. It's always good to see you.
Thank you.
You're recovering from knee surgery.
Right.
Are you okay?
I'm okay.
Okay, we won't make you go anywhere quite yet. So what is fat grafting?
Oh, I love fat.
Fat keeps you in business, doesn't it?
It's if it's in the right places, you know.
Okay.
But yeah, so it is a hot topic because recently the society allowed fat to be used in fat grafting of the breast as well.
Mm-hmm. Oh.
And
so we're moving fat from one area of the body to another area.
That's right. Yeah, and then that was kind of a hot topic, and because there's still some uncertainties about that. But yeah, so I've been doing that for the past year and a half or so.
What are the advantages of it?
Well, the fat is obviously your own fat.
Right.
You know, it's just natural. This is like
in
the OR when we collect it and ready before injecting it.
You know what? Fat looks exactly like what you would think it would look like, doesn't it? That's amazing.
I love fat.
So, so your body's not going to reject it because it's yours.
No, it's your own fat. You cannot use your neighbor's fat or your sister's fat.
Can I be a fat donor? That's what I'd like to know. Okay, so let's take a look at some pictures that help us understand how this is used. So we have a few before and after pictures.
Yeah. So this is a lady who's 57, and she presented pretty emaciated looking, and then I just did a couple of sessions of fat grafting for her whole face.
So did you put it under her eye?
Actually, I put it in her cheeks, under her eye, but it actually lifted. You know, I didn't put in her upper lids, but actually improved her upper lids as well.
Yeah, that's
great. But her cheeks, nasolabial folds, you know, so kind of built her up a little bit. She
so
still
it just brings you back some of that volume from your youth, right?
That's right.
Okay,
that's
great.
Right.
Let's see our next picture.
So
she should be happy. That looks nice.
This is a young man who actually has a skeletal problem. His right forehead is really flat because the skeletal suture is closed, and you know, the way to fix that is have craniofacial surgery. Peel your forehead down, you know, break the bone, reshape the bone, put it back, or put fat in. After about three sessions of fat in his forehead, initially it's really tough because he was really plastered down, but after the first session when things got a little bit softer, then I did 2 more sessions of fat grafting in his forehead. And actually, you know, people don't take a second look at him. What happened? You know,
you restored the symmetry to his face. Great. Let's see our next one.
Yeah, this is a young lady who actually has a bony depression, and she doesn't remember when she was young if she had an injury or what, but ended up like that. So again, to fix that would be major surgery with peeling her forehead down and reshaping the bone, or putting some plates in there, or inject fat and the local, so it doesn't have to go under anesthesia.
Really? She just was able to do it in your office?
Yeah.
Look at that. That's really
This is after one session. I went back and I added a little bit more for her, just above the brow.
Now, will this stay, since it's your fat and it's it's not something that's going to resorb, I presume?
Well, you will lose certain volume, especially when you do large volume fat grafting. I tell patients that probably they will lose about 30% in volume.
Okay. But you can come in for a touch-up, right?
Yes, correct.
You probably aren't going to run out of fat. Do we have any more pictures we want to take a look at?
Yeah, we have.
Okay.
I think
Let's
we have.
pop them up. Okay, the butt dimple. There we go.
This lady, this is 7 years out after one session of fat grafting.
What?
So it's never had to do anything.
So you filled this little, I don't know what to call it, a dimple, a divot?
Well, actually, she had a bad cold, went to her primary care physician, and he decided to give her a big steroid shot, and it melted her fat away.
No way.
And yeah, so that was after one session of correcting that, one session of fat grafting.
And so all those years later, everything's good.
7 years later, yeah.
That is amazing.
It's like human Play-Doh, you know. It's I love it.
You're a sculptor. All right, one more set of pictures to take a look at. And they're here.
And this is a buttock augmentation on a lady who wanted to have a bit fuller, rounder buttock. So what we do, we liposuction the whole midsection. As you see, those bra rolls and hip rolls are gone, and the fat is infiltrated into the muscle of the buttocks and into the deep fat of the buttocks to reshape it and give it a
wow.
Better.
So the love handles went away.
Right. So actually makes her,
she got some booty.
Right. With buttock augmentation, you know, it's you subtract fat from the areas you don't want fat, and you put it where you want it. So
don't we all want to do that? That is, that's pretty amazing. And so it's interesting. This can be used for breast augmentation. So that means that we wouldn't have the problems with foreign substances.
Right. But even if somebody has implants and they have issues with thinning, or or even with capsular contracture, now with fat, we can actually adding fat into that area. We don't know why, but probably the stem cells, and I don't want to advocate this as a stem cell treatment, but it changes the quality of the tissues, and things get softer and better. So
very interesting. Thank you so much. That was really very nice. It's nice of those people to let us use their pictures. We'll link you to Bellevue Plastic Surgeons on our website right after the show with resources for information or for booking a consultation. And Dr. Marosan will be back a little bit later on our Wellness Wednesday Doctors Panel to answer your questions. A bit later on New Day, it was an explosive week of playoffs on The Voice on NBC. We'll recap some of the amazing performances with Brooke Fox and our big red chairs in just a bit. But first, how hormones and even digestion can speed up or slow down the aging process when Wellness Wednesday continues.